Hey everybody, it's Kimmy. I promise it's me. Welcome back to my channel. I just wanted to come here quickly and give you an example of nursing charting. This is actually a response from one of my subscribers. His or her name is Mika or Micah, the Supreme Overlord. I'm so sorry if I'm mispronouncing your screen name. It's quite a name you got there. But anyways, I wanted to come here quickly and show you guys an example of how to do nursing charting. Like, so basically, what would you write in the patient's chart and what would you write on the report? And this is like so simple, but I wanted to come here and tell you guys what I mean by copy the note but not really follow it. So of course I'm going to spare the patient's name for HIPAA, but when I went to work today, I just wrote down like an example. So this is one example, and the first one is very easy. So you could just write TPR, temperature, pulse, respiration. And usually we start out in the vital signs. So, or some people put it at the end. 97, 69, BP 120 over 78, and then O2 sat is 96%, right? If the patient's on oxygen, this patient was on oxygen, so in this case I would put on oxygen 2 liters per minute via nasal cannula. So that's how the patient is receiving their oxygen. They're receiving it via nasal cannula and at 2 liters per minute. Okay. Oh, that's not how you spell cannula. You actually put one more N there, I believe. And then you will just write something about the patient. So, resident, you could just write out resident. I'll just write it out for you guys. Resident is awake and responsive. In no distress. SP, meaning status post. This time the patient was day 2 of 7. It's always good to write. Some nurses leave out the total number of days, but it's always good to write what day they are in and the total number of days, so that the nurse who lies on day 7, so she doesn't have to keep continuing the note because that becomes redundant. But day 2 of 7 day readmit. At my other job where I used to work, readmission was actually 30 days, so we have to do this for 30 days. I don't know why. Readmit to the unit. Resident adjusting well to the unit, Resident is adjusting, just spell out adjusting well to the unit. And this is my signature. Safety precautions maintained. Will continue to monitor. And there you have it. That's your first note. Here we have a second, more complex note, if you will. This resident is on, I believe, antibiotics, hemodialysis. So we got to make some notes on that, right? So we're going to start with our TPR. Okay, I did that in the previous example, so I just won't write it out, right? But this time the patient is on oxygen. Their oxygen saturation is 99, and they are on room air, right? So they're not having any oxygen to support them, right? So resident is alert and responsive. You know, you could write resident, responsive, and I'm just doing that for space purposes. In no distress. It's always good to write how your resident is doing, just so that if somebody calls, their family member calls, like, oh, how my family member is doing, not only can you say it over the phone, but you could have that in document. Because, you know, like nursing, how they teach you, if it's not documented, it's not done, right? So after that, you could put status post, hemodialysis, however you spell that. This is very important. So positive, or you can write out positive. Brute and thrill. Present, that is really important in hemodialysis. Patient, you have to say that. At the left, you know, you can write out left. Abbreviations are not really favored in nursing anymore. AV, at the left, AV shunt site, right? Clean and intact. So you make sure that, like, on your shift, it's clean and intact. If the nurses on the other shift didn't want to make sure it's clean and intact, at least you know that on your shift, your patient is clean and intact, right? And then no active bleeding. Noted at this time. Sorry for my handwriting, guys. Okay. So now we're up to the K-flex. So resident continues on, remember the day is very important, day 3 of 7, K-flex, the milligrams, capsule if you want. Yes, the capsule if you want. Make sure you just spell out whatever you want. I wouldn't encourage, anyways, honestly, I wouldn't encourage abbreviations, like I said. Capsule. And then you're going to write what it's for. So for cutaneous, this person had a cutaneous abscess to the lower chest area. And this is really important too, especially if the patient's on an antibiotic. No adverse reactions noted. Or you can just write Narn. No, not the Chronicles of Narnia, just Narn. Then you could put the patient, you know, like extra fluids given. You know, that's really important when they're on an antibiotic. Extra fluids given, you know, offered as tolerated. In this patient, swelling was observed to their site, was evident to site where they had the infection. No drainage noted. Right? Patient, remain, just write remain. I don't have any space. Afebrile, right? Afebrile on this tour. And then after all that, safety precautions maintained. We'll continue to monitor. So yeah, guys, this was just like a quick impromptu video. I'm not even gonna edit this. I'm just gonna post it tonight. And I hope this helped you guys in writing your nursing notes. Like, don't overthink it, guys. It's really not that hard. Just like for example, if I was a previous nurse and I wrote this, just like kind of follow along what I'm saying. I'm not telling you to write word for word, of course, because, you know, when state comes, it's going to look fishy. And then people will talk about you too. So just kind of follow along what the patient said. Maybe move some words around. Definitely reread it just in case the other nurse made a mistake. You're not copying that mistake. That can happen. But like, that's just like a basic of what you would do. It's not hard at all. The more you do it, the more you get practice. The more practice you have, the easier it will be. Okay, bye for now.